My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs at HHS, and pleased, as always, to be moderating today's town hall on Thursday, April 7th. Lots going on across our sites and services, but before we begin with our formal agenda, just a bit of housekeeping for everyone. You'll be able to ask questions of our presenters. If something comes up that you'd like to know more about, you can send an email to hhsnews@hhsc.ca. That's our question line, and we'll have that address up for you later. You can also ask questions via the hub after the fact. At the end of our presentations today, we'll also, as is our tradition, have time for celebrations. So keep in mind as you're thinking and hearing and listening today, what you might like to celebrate, a colleague or a team or an accomplishment, and you'll be able to give that celebration live or type it in the chat forum at the end of the session, and we'll read it out for you. Okay, so I think that's the housekeeping out of the way. Our CEO, Rob McKay, we're very, very pleased to have Sharon Pearson fill in for Rob today. So without further ado, Sharon, over to you.
Great. Thank you, Aaron, and good morning, everyone, and happy to be here for Rob this morning. We'll begin as we usually do with our land acknowledgement. Today, we are privileged to provide care on the lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. So today I'm fortunate in that I get to provide 3 positive updates in the opening remarks, which is great. We'll talk about our operations across our sites, our regular update from Dr. Dominic Merks, some reminders around safety measures from Susan Fucciarelli from Occupational Health and Safety, and then an update on our Odyssey project that's looming closely from Dr. Barry Lum, and then as usual, time for our celebrations. So I would like to start with a really positive note in that Hamilton Health Sciences is among the inaugural signees of the Hamilton Charter for Promoting Gender Equity in Healthcare in partnership with St. Joe's and the Faculty of Health Sciences. So the charter specifically calls for work to advance and include women identifying gender diverse, racialized, and other equity deserving healthcare workers to create an environment of inclusion for all. So very exciting moment to have this charter signed in Hamilton. Credit for developing the charter goes to Drs. Sonia Nod and Mark Walton of HHS and McMaster University. And it was signed during the inaugural McMaster Faculty of Health Sciences Women in Medicine Symposium just last week. I did have an opportunity to attend, and it was a wonderful session, and everyone embracing this moment with the signing of the charter, which really will mean the 3 city major health sciences organizations are committed to creating an inclusive, barrier-free for all equity-deserving individuals. And so we'll continue to work with our respective EDI strategies to advance the work of the charter within our own organization. And another good news, since our last town hall, we are pleased to have reached another milestone in the redevelopment of the West Lincoln Memorial Hospital. We announced that the Elliston Infrastructure Healthcare has been selected as the new preferred proponent to build and finance and design our new hospital in Grimsby. So this is a really exciting step because it does solidify the reality of a new hospital at West Lincoln that has been so long awaited for by the staff and the community. And many thanks to all that have helped on this, because it has been truly a collective effort internally with our HHS team, our West Lincoln site, and of course, all of our community partners. And then finally, really proud to share that HHS has exceeded its annual blood donation goal, thanks to so many of the staff and the physicians who rolled up their sleeves for the Canadian Blood Services campaign, which was the Partners for Life program. Last year, staff and physicians at HHS donated 202 units of blood, which is double our annual goal, and a 238% increase, which is phenomenal. So CBS, in response, upped our challenge this year. So we will pledge 175 units to be donated by HHS staff and physicians. So please go to blood.ca to book your appointments and indicate you work at HHS. I know that every day, many of you see the impact of these donations. So we really appreciate all of you going above and beyond and showing your support this way. So it's wonderful. So after 3 good news stories, I will talk about our operations across our sites. You can see the regular update in terms of our COVID numbers. So we continue to hover between the 30 and 45 mark on most days now, with less than 5 in the ICU and sustaining 1 to 2 outbreaks. So 2 currently. We have seen, unfortunately, a rise in our numbers of staff in self-isolation. So pretty significant increments. We now have 546 staff and physicians in self-isolation. And I do know that that is making staffing incredibly challenging across our units. In terms of the occupancy, you can see our occupancy there in the table in front of you. So at an aggregate over 100%, but really you can see what's happening across our sites. West Lincoln particularly pressured at 112 sites, along with the other adult acute sites. And you can see Mumsy not far below. So really everyone is really feeling the capacity and volume issues across our clinical units. Our ALC remains in the 190 to 200 mark. So that is above where we had been, which is closer to 170. We know that's a reflection of the challenges in our home and community care facilities. The next slide. We continue our work to ramp up on our surgical and procedural activities with respect to where we're at relative to pre-COVID volumes. We're about 80%. We are aligned to the provincial framework. We are working to get to 90%, but of course we need to be very gradual and very thoughtful in our ramp up activities because of the sustained health human resource pressures we have, but we also always need to make sure we're able to meet those regional needs for our programs, and being able to respond to our ED pressures, which are significant. So lots of work continues locally and within Ontario West for the ramp up. And then next slide, obviously, in order to ensure we have good flow, we continue to work on our post-acute activities and support. The satellite health facility will continue into operations into 2022 with the 90 beds. We also operate a number of beds, 11 beds at the St. Joseph's Villa as well, thanks to support from Ontario Health. We continue to maximize our capacity at St. Peter's Hospital, always advancing throughput through that hospital, which, you know, we always forget how big it is, but it's over 230 beds. And then continue to advance our partnerships with our community agencies like Thrive, Able Living, Good Shepherd, SC Health, etc., to avoid admissions and really work on expediting discharges. So all we can do to try to keep flow going across our sites. But I acknowledge it is a very stressful time in our hospitals right now with the pressures that we face, and I appreciate everyone's contributions greatly. And with that, I am going to hand it over to Dr. Dominic Mertz for a discussion around how we're doing with COVID.
Yeah, thank you, Sharon. A mixed bag what I'm presenting today. Let's start off here with the provincial view on hospital admissions. And you probably all heard that, and I've shown you before 2 weeks ago that we saw that we were at the probably lowest point and that things will increase from then on. And that's what you now see over the last couple of weeks here. Next slide. We are comparable right now to where we were in the first week of January with roughly 1,100 patients with COVID admitted to hospital. And on the next slide, you can also see, and that will explain what you will see later in the models as to why we don't expect the same to occur as occurred in the first few weeks of January. We are on a different trajectory. Now, these are lines, and we all know infectious diseases have an exponential growth, so it's certainly not perfect. But it gives you an idea where we were at in terms of increase from week to week, beginning of January versus where we are now at the beginning of April. Next slide. I also added here, just for your information, the sort of the time points where there have been changes in terms of public health measures, keeping in mind that until you see an effect on hospital admission, it takes at least 2 to 3 weeks. So with this being said, the effect that we see right now, if you want to link that to the public health measures, It would be the effect of change of capacity limits, potential of the end of vaccine passports. Masking is not yet in the mix. That will be something that would show itself in the next, maybe this week and in the next couple of weeks to come. Next slide. Hamilton is sort of defeating that trend that we see at the provincial level. So these are our hospital admissions with COVID within the city of Hamilton. And 2 weeks ago, I would have told, or I did tell you, we also see that increase actually 1 week earlier than the rest of the province, but it didn't continue from there. We are not the only region that shows the same trend that we have, which is relatively flat. Do I have an explanation for that? No. We might just start later, or we will see. I think the next couple of weeks will show as well where we will be heading, but certainly at this point, good news from a City of Hamilton perspective that our hospital admissions remain quite stable, despite the fact there's certainly much more COVID out there in the community than 3, 4, 5 weeks ago. Next slide. I showed you that previously. We are currently sitting at the similar number of hospital admissions as we did during the Delta wave in August, September 2021. Next slide. In terms of ICU admission, again, provincial level, so far stable over the last couple of weeks, today at 153. So I think lowest ever since Omicron. But overall, it looks like, things will eventually be climbing up rather than going further down. We are so currently in a sort of trough plateau that we don't know exactly how long it will last, but certainly the expectation is that it will start creeping up as well. Next slide. And again, here the comparison from an ICU perspective, similar to where we've been sitting throughout summer last year. Next slide. These are our ICU admissions in Hamilton, and similar to hospital admissions in general, stable over the last 5 weeks, comparable to December 2021 and December 2020. So again, locally good news. Next slide. I've shown you this busy figure 2 weeks ago as well, which shows you how the variant of concerns from Alpha to Delta to Omicron sort of replaced each other, that the replacement by Omicron was very quick, but now the replacement with the Omicron sublineage BA2 of the other lineages isn't as fast, but as you can see here, based on data from up to March 12th, so that's almost 4 weeks old at this point, we were at roughly close to 40% BA2. So it's safe to assume at this point that we have predominantly BA2. Next slide. Back then, Hamilton had more BA2 than the provincial average with 43.5%. Again, safe to assume that we are far beyond 50% at this point of time for Hamilton. Next slide. These are the provincial predictions for hospital admissions. And as you probably have heard already, it's not looking as good as predicted, sitting at more than 1,000 hospital or people admitted at this point, while the prediction would have been maybe 700-ish at this point in the moderate increase in transmission scenario. And as you probably heard as well, there will be new modeling coming out later today. Next slide. In terms of ICU admission, however, things are holding up so far and continues to follow the best case scenario that the science table put out, 3-4 weeks ago, March 17. Next slide. These are our citywide predictions that I've shown you the last time on March 14, where we did see that increase. And as you can see, it did increase pretty much along the line that it had been predicted. But now we saw that sort of unexpected drop over the last week. Next slide. Hamilton also updated its predictions with data up to March 28th. which now predicts a much longer wave, but a very different shape, as you can see, to previous waves. So this would be our hospital wave, not case wave. And you can see that it sort of drags on in the current prediction into mid-June, with slowly increasing hospital admissions up to then, and then mid to end June starting to fall. So this is the best prediction for the city at this point of time, and I would expect that the science table changes will be moving to that direction as well. And as you can see, too early to tell how we are following this prediction. At this point, again, there's a lot of uncertainty, as with all the models that I've shown you over the last 2-3 months when it comes to Omicron, because we don't fully understand what's the case numbers actually out there. Next slide. ICU admissions here, we don't expect huge changes until end of May. This is based on the March 14 model again, where we are sort within those predictions. Next slide, again, the updated model, where you see that there will not be very significant changes predicted, that the number of hospital admissions of Hamiltonians, that's what you see here, that require ICU, will remain in the current ballpark going into end of June. Next slide. Vaccines, nothing changed really. You still see that roughly 40% risk reduction for infection, and that much more significant reduction in risk of hospital admissions and ICU admissions. And that's really what you see to play out as to why the models look like that, despite the province estimating that we probably have 100,000 cases of COVID every single day. It's not the same way as it would have looked a year ago, thanks to the immunity that we were able to build up. Next slide. So take home messages here. So staff absenteeism is probably the single most challenging piece for us at this point of time. It's not the number of hospital admissions that are skyrocketing, but staff absenteeism. And that's probably something that will continue over the weeks and months to come, based on the shape of the expected wave. So certainly continue to be a major challenge, maybe more staff absenteeism being more of a challenge than hospital admissions. As shown, the trajectory is different from the Omicron wave in January, which is the good news. It's likely going to look more protracted, or using the terminology that we started to use 2 years ago, more flattened, thanks to the immunity that we have. And vaccines continue to be the best means to protect us from severe disease. And as you probably heard as well, starting today, 4th doses are available for the 60+ population. And I also a reminder, 3rd doses are still available as well. And when you think where we are at in the pandemic right now, expecting a prolonged wave with many infections to occur, apologies, it would be a good point of time right now to get that 3rd dose if you haven't yet, or the 4th dose if you're 60+, because it will prevent or protect you much better in the next 4 weeks roughly, due to the boosting of your immunity. We know that okay, my apologies. One of the effects of working from home. So what I try to say is you will benefit from that short-term protection from infections if you get your 3rd dose or 4th dose at this point of time, if you qualify. We know that this effect will be waning, while the effect on protecting you from severe disease will last. So in terms of timing, now is a great point of time, particularly if you haven't had Omicron already since the end of December. Handing back to Aaron at this point.
Yeah, thanks very much, Dominic, for that update. Very informative, and thanks to Sharon before you. Next up on our agenda, we have Susan Pucciarelli, who's our Director of Health, Safety and Wellness. Susan's going to give us an update on the safety measures still in play and what's important across our sites. Susan, what do we need to be doing?
Thanks, Aaron. So just on the heels of what Sharon and Dominic have just said, in addition to that continued vigilance and potentially getting your next booster shot, just making sure that everybody is still being vigilant around the safety measures that we have in place. Sharon has already mentioned the astronomical increase that we've seen in staff absenteeism, and it's important that we do everything that we can within the hospital, certainly, and even in your personal and home lives to try and protect yourselves. So within the hospital, just making sure again that everybody is masking at all times, and when you are taking your nutrition breaks, or other occasions where you are removing your mask, please ensure that you are maintaining the physical distancing so that we don't have that close contact type of situation occurring within the hospital. Also, just reinforcing again that everybody should still be doing the self-screening before you come into work. And so this is important just from a monitoring perspective to make sure that you understand what is required, when to contact EHS, how to go about getting tested if you need that kind of support. And we just want to be here from an EHS perspective to be able to provide that support to you. So doing your active screening on a daily basis when you're coming into work, and just making sure that you're following through on that and contacting EHS. I would ask that you please call the EHS hotline number, so 42200, and just use the one mode of contact. So again, with the numbers climbing as they have, duplicating calling and then emailing is bogging down the EHS nurses. So if you could call them, I appreciate your patience in waiting for a return call. Certainly there is no need to wait. If you need a PCR test, you can go directly to the Upper James Clinic and have that test. You do not have to have that referral from EHS. We just ask that you call, give us your information, and then the EHS nurse will follow up with you. Certainly, if you have a positive result, they will be contacting you to provide you with further support and direction. And then the last thing is just around the availability of the rapid antigen testing kits. So again, these are used in specific circumstances where there has been an exposure or where you have become positive. So EHS will direct you if you need to obtain that RAT kit from them. Please do not go into the EHS office just to pick one up randomly. We don't have that level of supply, so we're really looking to ask you to follow that direction from EHS. So bottom line is, let's please continue our vigilance. Thank you so much.
Thanks very much, Susan. Okay, next up on our agenda, Dr. Barry Lum, who's our executive lead for our Project Odyssey. How are things going and what do we need to know this week?
Thanks, Andrew. Hi, everybody again. Thanks for the opportunity to keep you up to date on Odyssey during the midst of all of the other challenges that we're experiencing. You're all now very familiar with our roadmap, and as we are getting closer and closer to phase 5, which is, of course, go live. Next slide, please. So in that theme, we are 57 days away from our go live on June the 4th. And of course, the teams across the entire organization are working really incredibly hard to get us ready to make that change. Next slide, please. So what do you need to know? We'd like you to focus a little bit more on high impact workflows. These are workflows that will see a major shift in practice when HHS goes live with Epic. And these workflows need additional attention and oversight beyond the training that we are all going to be doing in class to ensure that the risks associated with these major changes in workflows don't delay or impair the care that we need to be able to provide at the moment that we are now in the Epic world. So the group has done an incredible amount of work on these 23 high impact workflows. And there's a ton of information available on the hub that will allow you to see all of them. And then as you flip through and look at them, please identify those that are relevant to the way you'll go about your business, and take the opportunity to review the material under those tabs, which will include tip sheets, one-pagers, and some demo videos. So really important that you take the opportunity to do that, please, and take the opportunity in your own huddles to talk about those high impact workflows within the CQI workflow and matrix that we use every day. The workflow this week that's being highlighted is Rover, which of course is a very neat and important part of our nursing and several other disciplines care on a day-to-day basis, and how they take that mobile device to the bedside to scan and provide other kinds of care. Next slide, please. Some comments about training. I know you've heard about it a lot, but I'd ask you just to continue to bear with us. The registration rate now for training is really well over 90%, and we will continue to register people as they come along. If you have staff or you're aware of staff who are new to the organization, please make sure that we know about them so that we can be sure that they get the opportunity to be registered. And from a sort of maintenance of the accuracy of the database, if you're also aware, especially leaders, of individuals who have left the organization and won't need to train, it's important that we know about that so that we can keep all of the available slots open whenever possible. A couple of comments about e-learning. You've heard me say this before, but the e-learning part of the training must be completed before you show up for your in-class training. So please take the opportunity to do that. As I've said before, they're short little vignettes, maybe 3 to 5, maybe 7 minutes, that will help you start to feel what it's going to be like in the EPIC world. And I would emphasize that you can go back to those at any time if you feel you need to get a little refresher. If you're signed up, we need you to show up for your training. If you're more than 15 minutes late, we will not be able to give you credit for that class time. We will be providing parking, and of course, after that, you'll hear about the playground, which will allow you to test out and practice the training that you've already, excuse me, already undertaken. You'll see on the bottom left there are 2 emails for provider and non-provider training. And I will tell you that the office hours for the non-provider training will be starting again to help people get the last few inches across the finish line. Next slide, please. You're all aware that virtual care has become an incredibly important part of how we have moved through the pandemic. And the virtual care team is busy preparing the organization to be able to do virtual care within the EPIC environment. I've seen some of this as recently as yesterday. It's not part of the ongoing in-class training, but it's really well done, and you will have the opportunity to review videos either alone or as a team beginning in May on how to provide virtual care within the organization. And I would encourage you to take advantage of that. They really have done some excellent work. Next slide, please. So what's coming up? Well, I've mentioned in-class training. We are going to be having something called patient flow days for staff and physicians. You'll hear more about that. Many areas in the organization will be given the opportunity to do something called shadow charting, which is an opportunity to test out the system a little bit, get the feel for what it's like, and then to actually see some actual charting as care is undertaken. User setting labs are for physicians, are mandatory with the exception of those who have tested out, and you'll be hearing more about those if you haven't even perhaps got one scheduled now. Organizational readiness days readiness day, excuse me, is scheduled for April the 27th. And that's an opportunity for us to show the leaders in the organization what it will be like when we go live, how it will work, how the sites will work, how the command center will work, and what you can expect. In May, you're going to hear about something called workflow dress rehearsals. These will be at selected sites and will be an opportunity for a simulated patient to actually come into the hospital, be registered, and to move through a care plan for a day and how we might identify areas where there are problems, but also give, again, a chance for people to test and taste the system. The 30-day GLRA is scheduled for May 11th. And of course, throughout May, the in-class training will continue, as well as the super user refresher and the shadow charting. Next slide, please. So once again, as always, we finish with this slide that says, reach out to us at any time at odyssey@hhsc.ca. And of course, you saw the 2 email addresses specifically related to training. And Aaron, that's it for me again this week. Thanks.
All right, lots packed in there. Thanks very much, Barry, for that. As I mentioned earlier, and by Barry a moment ago, you can always email questions, Odyssey related or related to anything that you've heard in today's presentations, or maybe something we didn't cover that you'd like to know more about. You can send those questions to hhsnews@hhsc.ca. Emails there on your screen. That, of course, is also accessible on the hub. You'll get an answer promptly from those with the right content expertise to support you. Okay, so thanks to all of our presenters. We're moving swiftly through our agenda today. I know everybody's busy, so let's move right to celebrations. And Leslie Gillies, you have a hand up right away. What would you like to celebrate today?
I had to get in on it there, Aaron. Thank you. Just really proud, really grateful. A bit of a site shout out to everyone's hard work at the St. Peter's Satellite Health UCC in West Lincoln. Lots of activity happening. Thank you to the staff, the physicians, the leaders at SHF and St. Peter's, really working hard to maintain full occupancy every single day to support and transfer and care for patients coming from the acute and the community as well. West Lincoln has hit a little bit of a milestone, which is 100% of their surgical activity. So we're very grateful to be back in operations regarding surgery at the site. And since March 24th, of course, the urgent care center opening, really starting to see a surge and increasing number of patients coming to the West End Clinic. So appreciative of all the hard work that's underway despite some staffing challenges. Really appreciate everyone's dedication. Thanks.
Wonderful. Thanks for that shout out today, Leslie Gillies. Okay, I see something. One of our panelists, Elizabeth, has a hand up. And Elizabeth, I'll just send you a note that'll allow you to unmute yourself and you can give your shout out live. So go ahead.
Can you hear me?
Yes, can hear you.
Thank you. It's actually not a celebration. It's just a follow up. I brought up a concern at the last town hall. I did add it on to a celebration to acknowledge all those who've been redeployed over the 2 years and obviously the impact it's had on morale, and asking about any kind of reconciliation about the impact it's had on all of us. That was my understanding, is that was going to be added to this town hall, and I don't see that it has been. And I just wanted to express that's unfortunate, and also whether or not there is anything being done about the impact that it's had on all of us over the last 2 years.
Yeah, I appreciate that. And I know, Elizabeth, I remember your concern. I'm sure there's no simple one answer anyone could give on that topic. Several conversations and many initiatives. Unfortunately, we find ourselves in the thick of it again. But I know it's a deep concern to senior leadership. Sharon, I see you on camera. Is there something you'd add to that?
For sure. And thanks for your comments, Elizabeth. And, we are so appreciative, and I do understand how it's been very impactful for the individuals that were redeployed, some 312. of our staff to other areas. And Kirsten Kroll and many others within her team have been working very hard to support this process and really trying to ensure we put the supports in place as necessary. There will be follow-up. There will be opportunities to provide feedback about the experience and what might we do differently. I would never say we won't ever have to do it again. And we always want to be the best that we can when we have to make these difficult decisions. So I appreciate it, Elizabeth. And I'm sure you will hear more about it and an opportunity for you to provide your feedback, and would encourage you to provide your feedback to your immediate leader as well.
Okay, thanks for that, Sharon. And sorry we didn't address it in deliberate manner today, Elizabeth. It was considered, but you know, like I said, there was no one work in progress, but really appreciate you highlighting it again today. I do see another hand up in our participants, Vanessa Manning. Vanessa, it's the same MO. You'll get a note that says that you can unmute and you can go ahead and give your shout out live now. You're still in the mute, but we'll see. We'll try again in a minute. Maybe if any of our panelists or anyone else, let's check our chat forum. Sorry, I haven't done that yet. I'm not on my A game today. So we do have from Lori McLeod that next week's National Med Lab Week. Please thank lab technologists for all the COVID testing, for cross-matching all those units that HHS staff are doing. Absolutely. Thanks, Lori. From Naham Azam, amazing performance by Dr. Smita Halder and Voices Rock Medicine Choir on Canada's Got Talent. What a great highlight to see on the hub. Yes, if you haven't seen that, our own Dr. Halder was singing as part of a choir on Canada's Got Talent. Way to go, Smita. Congrats. And thanks, Naham, for pointing that out for everyone. From Claire O'Connor is unblocked. To you, thank you, excuse me, to all those involved, HITS, Telecom, Privacy, Virtual Care Ops team, and others, and especially Julie Matthews for bringing this over the finish line. Great accomplishment. Thanks, Claire, for reminding us. From Amy McKenzie, I second the congrats to Dr. Smita Halder for her amazing performance. What a bright light. If you haven't seen that, I encourage you to check it out for sure. Okay, let's check back in with our participants forum. See if Vanessa, I'm going to send that note to you again. You'll get an opportunity to give your shout out. We'll see if it works. Oh man, I hate it when it doesn't work. All right, well, if you can type it in the chat forum, then that's another way for us to make sure that your voice is heard. Bruce Squires, you have a hand up. What would you like to celebrate today?
Thanks very much, Aaron. Just with the closeout of the last fiscal year gives us a chance to look at some of the data, and one of the pieces that I've observed is for the first time ever, the HHS Labor and Delivery Program, Women's and Children's Health Program, saw 4,000 live births. That's in excess of 600 to 700 more deliveries than only 2 or 3 years ago. So want to celebrate everyone involved in caring for women, families, and these new babies, and also, you know, those are our new children who will eventually be part of our workforce. So excited to count them in our future team. Thanks very much.
There you go. Thanks, Bruce. All right. Well, I'm not seeing anything new in the chat forum, so perhaps Sharon, over to you.
Great. Thank you, Aaron. Thanks everyone for joining us today. I do hope you found it valuable. I know we're a bit briefer than usual, but a bit of time back for you, and we'll look forward to the next time that we're together. Have a good day, everybody.